COVID vaccine, both will be bad for the endothelial membrane. Pre-nuvo scan is a whole body MRI scan. They're basically a very high-tech whole body MRI scan. They can do a whole body MRI in less than an hour. So tesamorelin is sold as an FDA-approved drug called Yurth, and it's approved for visceral fat in HIV patients. So tirzepatide sold under the brand name Monjaro.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
If you have lower plasmalogen levels, you are more susceptible to a whole lot of diseases, but particularly neurodegenerative diseases. And what we found is that plasmalogen levels are low in almost all neurodegenerative diseases, including all types of dementia, Parkinson's, MS, lots of cancers, diabetes, heart diseases, strokes. They have a lot of antioxidant properties. When they took people who had the genetic marker, that ApoE4 gene marker for dementia, for Alzheimer's, if they had normal plasmalogen levels, they had equal, if not improved risk over other people. So it was really the plasmalogen level, not the ApoE level, that was more determinant of them developing Alzheimer's. And there was a great study from Rush University, this memory and aging project, that they've been following people for a long time, I think since 2006. And they found out that a 95-year-old who has high plasmalogen levels has the same chance of dying in 5 years as a 60-year-old with low plasmalogen levels. Basically, these are critical to life. COVID vaccine, both will be bad for the endothelial membrane. So it's the first thing that's damaged in your blood vessels when there's inflammatory changes, cholesterol changes, is that endothelial damage. And it's really critical because that inflammatory changes to the endothelium is going to create problems everywhere, from your brain to your heart to your kidneys. So we've well recognized now that there is definitely endothelial damage due to the spike protein. More spike protein, so infections, boosters, things like that, probably all contribute more to this. The relationship between this endothelial dysfunction and this hypercoagulable state that we've seen with long COVID, where people are throwing blood clots, that's probably because of the endothelial inflammatory changes. And we think it's a combination of factors. We actually think that it's a direct viral effect on the endothelium. We think it's cytokine release. We think it's oxidative stress. We think it's an immune cell response. There's a whole bunch of pieces that go into that endothelial dysfunction. And I think you have to address each of those to help treat this. Lithium is actually just a mineral, and it's found in foods we eat and water we drink. It's actually kind of a critical micronutrient for human physiology. So you actually need lithium in small amounts. It got its reputation in very high doses for treating sort of recalcitrant bipolar disorders and mood disorders. And in very high doses of lithium, it can become very toxic and has a lot of issues. But at a very, very tiny or micro dose, and sometimes even a very small dose, it has really significant benefits. Helps with mood. It's very neuroprotective, helps with detoxification pathways. Actually, interestingly enough, when you look at people who have tried to commit suicide, for instance, or people who have depressive disorders, and you measure lithium levels, they are almost lower than they are in people who do not have those same mood disorders. So we know that there's a play there in lithium. So you can microdose. Now you're talking about anywhere from 300 micrograms to 5 milligrams of lithium at a very, very small dose and improve these things. Pre-nuvo scan is a whole body MRI scan. They're basically a very high-tech whole body MRI scan. They can do a whole body MRI in less than an hour. They use these very cool AI algorithms to figure out disease processes, and it can screen for 500 different diseases. So could you say I can just do my pre-nuvo scan once a year and that's all I need to do? So I don't know how to answer this question. I think that I want to say that's a really good thing to do, right? And I'm not sure I'm quite there for a couple of reasons. So number one, most of the diseases that it's going to screen for, if you don't know you have, you shouldn't know you have, because they're not bothering you. Like I was looking at the list of things they found, like knee bursitis. I'm like, okay, if my knee doesn't hurt, do I care if I have a knee bursitis? And, appendicitis. Well, honestly, if you have appendicitis, you probably know it without going and getting your pre-novo MRI scan, probably, or in the hospital. And then tons of benign tumors and things like that. There were a few things, however. So one is cancers, right? And two is aneurysms. So brain aneurysms are one of those things that can just rupture and kill you, right? You don't know you have them oftentimes unless you have headaches and somebody does an MRI scan of your brain. You don't know you have them until they rupture and kill you, right? But they're very rare, right? So you find something that potentially could kill you. All right, David asks, can penisin polysulfate help with inflammation of tendons or ligaments such as tennis elbow or plantar fasciitis? Yes, David, it can. You have some of the same processes going on with the inflammatory cytokines. But one of the problems with tendons and plantar fasciitis is the vascular flow to those areas. And it's why they don't heal very well. So we will use a lot of things to improve vascular flow to the site. Sometimes as simple as just using nitrobid. What they use if you come into a hospital and you're hypertensive or having chest pain, you can take a little paste of nitrobid, and that's a vasodilator, right? And you can put it a couple times a day over the plantar fascia, over the tendons. It's going to bring blood flow to the area and make a huge difference in helping healing, because those don't heal because there's no blood flow. All right. So I love some of the vasodilators for that. And then the other option is something called AODHA. AODHA, we also use intra-articular. It's a peptide. It's a fragment of growth hormone with a little hyaluronic acid, but it's been shown to be very helpful in fascia and tendons as well. And then we can also inject BPC. So tirzepatide, sold under the brand name Mounjaro, is another diabetes drug. So you all got semaglutide onto your radar. The press helped us with that. Everybody started using semaglutide for fat loss and for all of its other benefits. So semaglutide, which is a glucagon-like peptide receptor agonist, a GLP-1 receptor agonist, has huge benefits, not just for fat loss, not just for metabolic control, but for brain health, cardiac health, liver health, kidney health, muscle building. So it is incredible. So semaglutide is an incredible peptide. The tirzepatide combined a GLP-1, so a semaglutide-like medication, so a GLP-1 agonist, that's what semaglutide is, with what's called a glucose-dependent insulin secretion or insulinotropic peptide, or what's called a GIP. Turns out when you combine a GLP and a GIP agonist, you even further contribute to weight loss, fat loss, metabolic control. The two have a synergistic effect. And that's because the GIP agonist they both work on what's called incretin hormones. The GIP agonist works kind of in the upper GI and probably the GLP in the lower tract. So together, what they found was tirzepatide over semaglutide, people had more weight loss, significantly more weight loss, and a little less side effects. So a little less of the reflux, a little less of the nausea. Lp(a) is basically a genetic lipoprotein that is an independent risk factor. So you can have completely perfect cholesterol, perfect metabolic control. And if you have high Lp(a) because you inherited it, then you will have an increased risk of cardiovascular disease. It's almost like a sticky glue. So it's very damaging in of itself. And we do not have any drugs that address Lp(a). Fat in general isn't good, right? So visceral fat's that belly fat. You can usually just look at somebody and say they have high visceral fat just because it's that beer belly. It's those guys you see with this sort of big old bellies. And it's because visceral fat sits around our organs. So fat is an endocrine organ. It's producing tons of substances, right? And unlike muscle, which produces a whole lot of good things, it produces a whole lot of bad things. So tesamorelin is sold as a FDA-approved drug called Yurth, and it's approved for visceral fat in HIV patients because the drugs they use for HIV patients cause accumulation of visceral fat and cardiac disease. And so Yurth is actually approved for that. So it works very well for visceral fat. But if you can't get it, what do? But for those people who can, semaglutide or tirzepatide, definitely options. We know that they preferentially hit visceral fat. So where you get fat loss everywhere, they do preferentially hit visceral fat. So those are great options. Something you might be able to get, though, you probably would have to, get it from us and we could mail it, but is the drug we just talked about. So a little different. So that leucine, niacin, citronol combination, great for lipids. Well, turns out when you mix low dose leucine, again, that kind of 1.1 gram, with a very low dose resveratrol. I personally am not a big fan of resveratrol, except at a very low dose. So at a very low dose, it has some really significant benefits. So you use like a 50 milligram dose of resveratrol and a little pyridoxine, like 15 milligrams in a capsule. And that was shown to have really significant benefits in helping visceral fat loss in general. So 5-amino-1-MQ, it's one of the few oral peptides, which is nice. And what it does is it blocks an enzyme called NNMT. So when you guys are all hearing about NAD, one of the issues with why NAD declines as we age, or if we're sick, or if something traumatic happens, is that we up NNMT, and that drains the NAD pool. So when all these people are throwing NAD or even NAD precursors like NMN and NR into the mix, if NNMT is upregulated, you're not going to help. In fact, you may be doing harm because the NNMT will then start bringing the NAD down into some toxic metabolites or some metabolites that have oxidative stress. So we know that a lot of cancers elevate NNMT. We know that a lot of metabolic diseases elevate NNMT. We know that being fat elevates NNMT. In fact, fat cells make this enzyme that depletes NAD. Osteoarthritis depletes NNMT. So higher NNMT is associated with multi-disorders. So if I have something that blocks NNMT, I'm going to be very helpful in treating those diseases, but I'm also going to increase the NAD pool